One of my goals is not to be somebody that loses the skill of being an orthopedic surgeon and stops growing and learning, right? Because as we all know, we go into practice as a surgeon, meaning that we're continuing to learn through our lifetime. For my shoulder surgeries, I'm spending a lot of time with newer technology, doing three-dimensional CT renderings and planning surgery in a three-dimensional context when patients have large deformities of the shoulder. I really do think that the future of medicine is in robotic surgery, it's in three-dimensional modeling and planning. As we do more and more replacements, whether it's of the knee or the shoulder, we're finding that if our plan is better, obviously it's going to work better for the patient, and we can use technology to our advantage now. So the shoulder replacements I do, if a patient has a large deformity, I do spend time reconstructing their shoulder on a three-dimensional platform, establishing how much bone loss they have, and then reconstructing that shoulder almost before doing the surgery using a computer template and software. And so we'll do that for these harder shoulder replacements, and it's been very successful. It also makes the surgery easier and faster because you kind of know what to expect when you go in there. I think from a learning perspective too, as we have fellows and stuff, it's going to be a great opportunity to sit down and plan this surgery with them and show them what's going on, to let them understand what we're doing and why we're doing it. And that's been fun for me. I try to stay up to date with industry conferences and other academic conferences, honestly, for that reason. Industry conferences, you know, some people are kind of poo-poo on them, but the reality is they do give you insight into what's coming. You never want to be too much on the forefront of what's coming because that assumes liability and risk, but you do want to know what's out there because sometimes it sparks other ideas too. So that's been one of my passions. And then in sports medicine, that is probably the fastest growing industry of medicine. And there's a lot of small technologies that we use in sports medicine for biologics and for reconstruction that are very effective. There are products out there that now allow us to get patients back faster. Surgeries that I've done that you would never think of doing, you know, thumb UCL reconstructions, Achilles repairs. We had a patient come back in 5 months from an Achilles repair to a Division I athlete position. That's kind of unheard of, and there's these newer techniques and technologies that are allowing us to do that, along with biologics, injecting platelet-rich plasma, injecting bone marrow concentrate. All of those things are kind of up and coming and being utilized, and we're able to do that and provide that for the patients. And I do see a change in our ability to return athletes to the field and the speed at the recovery. This industry is changing very quickly, and I hate to refer to it as an industry, but orthopedics is something that we explore a lot of new technologies in, and it's shown such a tremendous growth from the technology of knee replacements, shoulder replacements, ligament reconstructions that, you know, 10 years from now, we're going to be talking about robotic-assisted surgery where the surgeons are not even in the room for the procedure. And I think we're going to be talking about biologics that heal the ACL rather than reconstruct it. And that's already out. There's already stuff happening now that's being approved from that realm. And it's going to take time before everyone's wanting to use it and that we've shown efficacy, right? And that's my job, is to sift through that literature and make sure that it's something worthwhile.